Welcome and thank you for joining us today for our January webinar, Yeast-Free and Me. I am joined today with Dr. Don Ellsworth. I've asked him to join me today because he is so passionate about yeast. And so we're just going to answer some questions. Following a yeast treatment or eating program can absolutely change your life. It can improve your health. It can help you lose some weight. It can even help you with allergies. So these are some questions that we've encountered at the Wellness Center and in Physician's Preference also. And I know I've worked with Dr. Ellsworth for about 10 years, and so I know how passionate he is. And so let's just go ahead and get started with some questions. All right.
Well, thank you, Sally.
Absolutely. First, can you just explain what it is? What is yeast overgrowth?
Well, yeast overgrowth is basically candida, and it overgrows largely in our large intestine. And it is a fungus. Basically, think of it as a mold overgrowth problem. And nobody likes to live in a moldy house, and we really don't want a moldy internal home. And that's basically what we're talking about. And we have so many different problems once that happens.
That sounds a little scary when you think about just when you see mold growing in your house, and if you can envision that in your colon, right? So what makes that happen? Why would that even start?
That's a great question, and it wasn't really an issue when we didn't do a lot of what we do today with antibiotics and birth control pills and steroids. These are all common problems, largely. This was not an issue you would have encountered before this past century. Once we started using these medications, drugs, we really altered our bodies in some ways that were unintended consequences. When you take an antibiotic, you're going after the bad bacteria. You're trying to get rid of the sinus infection, the tonsil infection, the pneumonia, urinary tract infection. But there's some friendly bacteria that we absolutely cannot be healthy without. In fact, there's about 2 pounds of these good bacteria. And you see the yogurt commercials talking about the live cultures. And we're talking about bifidobacteria, lactobacilli. When those are eradicated, and they're actually pretty fragile, so you often really do wipe them out in a big way when you take an antibiotic. When you wipe those out, you leave the GI tract a perfect culture media for growing the candida or yeast. It's warm, it's moist, there's food. Just imagine
it's dark.
Yeah, dark.
Yes.
You have a dark, warm, damp place with food in your house. You come back and look at that area a week or two later, and stuff's going to be growing on it. Well, the GI tract is like that, and once yeast starts overgrowing, it takes on a life of its own because it can now defend itself against the things you might try to do to get rid of it.
Right, and sometimes you might not even know it's happening. Is that right? You just have other health problems that you don't associate maybe to yeast.
Yes, and there's a lot of symptoms that are subtle. And you know, Sally, I should also mention some things. I've talked with folks who say, you know, I've never taken an antibiotic. And that's actually rare when people go back and think about their childhood, because really, you never saw a doctor and took anything for an ear infection. You've never had strep throat. You've never had surgery where they talked about giving you antibiotics around the time of the surgery. But let's say you never took an antibiotic in your life. You could still get yeast overgrowth, even if you didn't take birth control pills, even if you didn't take steroids, because you'll often be exposed to the antibiotics and hormones in meat, like poultry. A lot of things you buy that is not organic. What do they do to prevent infection? They give them antibiotics. A lot of the milk you buy has antibiotics in it.
So you're getting them.
You're getting antibiotics in a lot of different ways. And then we add chlorine to the water, which is to kill the microorganisms, but it preferentially will kill off the more fragile bacteria, the good bacteria we need, over the hardier yeast. So bottom line is, it's not easy to avoid getting this problem of yeast overgrowth.
Right, so it's very important to try to reestablish that balance in the colon.
Absolutely critical. So if you have not recently done a yeast cleanse, the chances are you need to be doing this because we really are very prone to this problem.
Right, and so I know at the Wellness Center and Physician's Preference, we encourage our staff to do it at least once a year, and our guests. And so we've actually come up with what we call a 30-day yeast-free with me challenge. And that is really to help people just clean up their diet, get back on track, and to help make the new year a good year.
This is a behavioral change issue too. You have to eat differently to get rid of yeast. And before we get into what you need to do to get rid of it, though, I want to talk about some of the problems that come from yeast. You know, I think most of us assume that we have a problem and go to the doctor. The doctor is going to look at us, tell us what the problem is, and treat it.
Right.
The problem with candida or yeast is we don't hear about this in our training. We do not have a lecture that talks about. Now, what physicians are aware of is if you have a really sick person with a weak immune system, how fungal problems can be present. They know about that.
I saw that in my training in nursing school. Right. Absolutely, they'd have that secondary infection.
Exactly.
But yet they weren't going for the root cause.
Well, the problem comes in when you're perceived to be otherwise healthy. You don't have a problem with a weakened immune system from chemotherapy or other illnesses that really make a difference with our immune system.
And your blood work looks good.
Yeah, doctors assume that if there's any candida there, that it's not going to cause mischief. That's in part because we don't think about the GI tract as being as important as it is. The gut is actually not just for swallowing things, and doctors will look for tumors, when they do scoping, look for ulcers, but it's actually a very dynamic interface. Basically, the GI tract is where we take food, we break it down to the small little components that we need for good nutrition, and then it goes into our bloodstream in this pure form of just a single amino acid, a single little sugar. Instead of being when you first start to break things down, it's a group of things. And one of the big problems we get into with yeast overgrowth is the gut becomes leakier. It becomes more like, instead of being this very fine screen that you might imagine, a screen door in your house, where you have it very fine so even small mosquitoes can't get through, what you start winding up with is having a lot of holes. And so now you're starting to get these insects coming in and causing a lot of trouble. If the gut has leakiness to it, it'll let things in from the outside world that don't belong in your body. Your bloodstream should not be seeing these groups of amino acids. So you'll eat a perfectly harmless food, but your body doesn't break it down properly, so you start reacting to everything you're eating.
Wow.
This is very common. Food allergies develop when you have yeast overgrowth. Food allergies can look like things like, I feel tired. You ever heard that?
Absolutely, all the time.
I feel depressed.
Right.
I feel anxious. It can make you start having allergy symptoms. You can start having wheezing, asthma. You can start developing problems with reflux, and the list goes on, rashes. But basically, food allergies are one of the biggest problems with leaky gut and yeast overgrowth because they go together. So you have more problems with food allergies. You're also going to have more airborne allergies. It's not complex. If you're living in a moldy house, would you have more allergies?
Right. Absolutely.
If you're living with a moldy house, you're going to have more allergies.
And this is our house.
This.
Right.
And this is daily. This is day in, day out, 24/7.
Right.
You're also going to tend to have some fuzzy thinking. Brain fog is a common issue people report to us where they can't think clearly. And one of the things that can be going on is yeast overgrowth. Like 180 chemicals are made when we have yeast overgrowth.
Wow, that's amazing.
Including alcohol, actually. One of the interesting things about having yeast overgrowth is the sugary, starchy foods we eat are broken down into the little sugar components. But you know what yeast like to do with sugar? Turn it to alcohol.
A party.
And then it turns to aldehydes. And this microbrewery that we get in our GI tract is not the kind of thing that you want. Some people like the specialty beers made by microbreweries out there.
Right.
Well, you don't want it in here because this is 24/7. So you're waking up in the morning with the effects of the alcohol and those aldehydes making you fuzzy brain, feeling tired. People have actually had detectable levels of alcohol in their body who are non-drinkers simply from the yeast in their GI tract.
So it's like they're hungover all the time.
Exactly. You're having, maybe a high grade, but often it's a low grade feeling of being hungover, having too much to drink the night before, but it's not something that goes away in a few hours. You live with it 24/7. Imagine how horrible that would be.
Wow. That explains a lot why people just simply don't feel well and why they feel tired. That's amazing. So how do we get rid of it? What do we do?
Well, there's a lot of things you can do. Dietary changes and some things to kill the yeast and put in the good bacteria is the foundation. And what we often find is it takes about 3 months. But the steps to treatment are not that complex. If it's white, don't bite it for a while. And for example, a lot of folks will come in and they'll say, gosh, I have a lot of reflux. And I'm thinking to myself, in 3 months, you're going to almost certainly be telling me you don't have heartburn anymore. The people coming in on purple pill medications, good chance once they do this, wow, I feel so much better. I've come to see, the rashes, the eczemas, folks who have a lot of allergies. I'm coming to expect those folks to come back and say, my skin is significantly better. Or folks with autoimmune problems, wow, I feel better. And I mean, I know people have a hard time believing that getting the gut healthy can do this much, but if you don't have a healthy gut, you don't have anything when it comes to your health.
Right.
We have found that autoimmune problems actually start in the GI tract. The origins of rheumatoid arthritis, lupus, Graves' disease, type 1 diabetes, celiac disease start with an unhealthy GI tract. And autoimmune problems are largely not genetic. They're largely the environment. And nothing is more important than the environment of our gut, because when our GI tract's not healthy, we will definitely have more immune problems. So I want to stress that there's a myriad of problems that are out there that can be caused from your yeast overgrowth. And you may be thinking, I don't have yeast overgrowth. But if you have a chronic problem, there's a good chance it is connected. So how do you know you have yeast overgrowth? Well, if you've had antibiotics, you should assume you do, because you're going to get overgrowth of yeast. If you've taken any steroids, like for poison ivy, you should assume you have it, because steroids feed the yeast and it goes nuts. It just you have really rapid expansion of your yeast load when you take just one round, just for a week of steroids. If you've been on birth control pills, pregnancy increases yeast levels. So obviously, the more times you're pregnant, the more likely you have an increase in yeast just from that. So with all that, do you have yeast? It's pretty hard for you not to have yeast. And there's not a perfect test. I wish I had like with strep throat you can do a test, or with pregnancy you can do a simple test. We don't have that with yeast, but what we can see is the results of what happens when you get rid of the yeast. People see their improvement. Certain symptoms are more suggestive of yeast, but basically if you're not well and you've had antibiotics, we should do this yeast cleanse together. So first and foremost, we need to cut out the white starchy foods, because if you're feeding the yeast, their defenses are up. And by the way, speaking of defenses, there's a lot of reasons why it's hard to get rid of yeast. One of them is they actually hide under this layer called a biofilm, and they're actually kind of hiding from the things your body does to try to get rid of it. And then on top of that, these candida make things that go after the good bacteria in your body. So once you have it, they actually start killing off the friendly bacteria themselves. Do you remember how we discovered the penicillin, which is actually produced by a mold, which again is in the same family as yeast? It was in a petri dish, and the bacteria around it couldn't grow because it was making the substance, which thankfully Sir Alexander Fleming did the research and said, you know what, that looks like that could be useful, and that's where penicillin came from. Well, you have your own body making these type of these antibiotics basically in your GI tract. So you've got alcohol going on, you've got antibiotics, and they're being made inside of your body now. So to get rid of it, stop feeding it. A lot of folks find if they've ever done something in the low carb genre where they cut out all sugars and starches, they go, gosh, I just feel better. Part of what's going on when they're doing that is they're not feeding their candida, so it's not overgrowing. So cut out the white starchy foods, sugar, of course, high fructose corn syrup, any flour, and a lot of people think whole grain is okay, but actually it's still very sugary. So cut out all flour, and that's just a few things in the store: bread, pasta, pizza, cereal, cakes, cookies, crackers, tortillas, chips. So
anything processed, basically, if it comes in a package and man made it.
And you've heard people say shop on the outside of the grocery store, and that's basically because the middle of the store is packed with these things that are simple sugars and processed.
Right.
If it can sit in a box for a long period of time and not be refrigerated, it's a faux food, and you really want to stay away from it. So the other issues with things that feed yeast are going to be, watch out, fruit juice is very sugary. Milk, a lot of people forget that milk has lactose. So even if you're drinking skim milk, that's sugar. Potato and rice are eliminated month 1, as well as a few other things like lima beans. Of course, baked beans because sugar's added. A few other veggies are avoided, but those are the big ones, those white starchy ones. And when you avoid those, the yeast will stop growing. Think of them as just growing when you feed them. And then when you deprive them of what they need, they shrink up into what's called a spore. And now they're just sitting there. Now we can actually make some progress, because now they've dropped their defenses. And the way we get rid of it is with some prescription items. We often use nystatin and later fluconazole, but fortunately, we have some powerful over-the-counter tools that anyone can pick up downstairs and really make progress with knocking out their candida. We have the natural yeast cleanse, which is filled with some natural things that help kill the yeast, and the probiotics to put in the good bacteria. So basically, what we try to do over a 3-month period is pull up the yeast. Imagine a yard with lots of weeds. That's what we're doing here. Pulling up the weeds, getting rid of that yeast, And as we do that, we don't want to leave a void. We're planting grass seeds so that what we're going to have after 3 months is a very healthy lawn.
Awesome.
And we also have some additional tools, by the way, that you can pick up in physician's preference, something called interface, which dissolves that protective layer that the yeast like to hide behind. Now, not everybody needs that, but if you're having a problem with it not clearing up, if you take the interface with the probiotics and the natural yeast cleanse, you'll get even better results. And colostrum can also boost the immune system. We have Colostrum Complete, which is a great product for knocking out candida.
Right. Well, and now when that yeast starts kind of shriveling up, that's how I'm envisioning it, something else happens, and it starts releasing some toxins that I know we refer to it commonly as die off.
Right. The first person to describe this was a guy named Herxheimer, and so he often gets credit, and people sometimes say you're herxing, but the yeast die-off symptoms or herxing is common with anything where you knock out an infection or detox the body. The Herxheimer reaction can feel like a headache, feeling tired, a rash, and it's usually a symptom that you have bothering you anyway, but it comes back when you get rid of the yeast. Now, a lot of people build that up to be worse than it is. It's actually sometimes mild, and some people feel so much better when they start getting the yeast to stop producing the bad stuff, and they avoid the foods that they're reacting to, which are often the ones we eliminate, like wheat and dairy, that they actually feel better. So I don't want people to think it's harder than it is. And if you do have problems with yeast die-off, there are several steps that you can take. One is you can back off on the yeast killer you're taking, like the natural yeast cleanse. You can take NutriTabs, which is sodium bicarbonate, which calms down the reaction. And there's other things as well. You can take a psyllium or fiber, bentonite clay can be used, which helps bind the toxins. But there are things you can do so it's tolerable, because we understand that everybody has to function. Usually you can't say, time out, I'm going to do a yeast cleanse and nobody bother me for a certain period of time. So we can help you with that. But the bottom line is getting rid of yeast is an investment in your health that will pay off the rest of your life, because the exciting thing about doing this is when you finish, it doesn't come back. If you eat healthy and stay away from antibiotics, it'll often stay away. Now, you might need to do this from time to time, and that's why a lot of folks like every January to start January off with a yeast cleanse, just to get rid of any that might have built up before it becomes obvious it's there. And that's reasonable to do. But basically, once you get it out of your system, the wonderful thing is people will often stay at a much higher state of health.
Right. And something that I know it happened for me, and many of our guests report that their cravings for that food that feeds the yeast, it just goes away. It's like the yeast isn't there wanting to be fed. So their cravings for breads and sugars, it's under control.
And people underestimate how much they can change their cravings. I think one mental barrier to doing the yeast cleanse is telling yourself, there is no way I could live a month without whatever it is. And by the way, we also need folks to avoid beer and wine the first month, which is sometimes the challenge, because folks who drink wine every day tend to feel pretty strongly about that. If you eat bread every day, you can feel really strongly about that as well. But give yourself more credit for being flexible, because people can change. And I'm surprised how often I hear the words, it was so much easier than I thought. And it's because they weren't giving themselves credit for being able to change their daily routine as much as they really can.
Right. And so it just, what do they say? It takes 21 days to change a habit. And even just small changes, starting to make those small changes goes a long way towards your overall health. But committing for that 30 days, I mean, we could do almost anything for 30 days, right? So that's why we came up with this Yeast-Free with Me challenge. It is a 30-day, really motivational. We give you support. We give you eating plans. I mean, it is complimentary. That's how strongly we feel about this, that the impact it can make on your health.
Absolutely.
And you can actually sign up for it at www.yeastfreewithme.com or call 1-800-579-6545. We also have an optimal eating program book. You'll be getting parts from this just by simply signing up and being a part of the challenge. I believe we had like over 1,000 participants last year, and those numbers just keep going up and up, kind of like yeast does apparently in your system. So
the word's getting out. People are seeing their health improve, and they're getting excited about it, and they're saying this is easy. It's a great resource, and this investment in those 30 days will make the rest of your year a higher quality. And I can't tell you how many times that people report that that is one of the most important things they ever do for their health.
Right.
It is a really huge step towards health.
Right. And also we see it makes such big the impact on families, because all of those foods that are in the middle aisles are generally geared towards children.
Mm.
And so in our fast-paced lives, we're trying to do fast food for our kids, and we're just setting them up for these issues down the road. So changing your life first, and then watching that positive impact on your family, on your children, can just go help their overall health for the rest of their lives.
Absolutely. And this isn't hard. It really doesn't require, if you think of all the things you can do for your health, think of how simple this is. You're just cutting out some white starchy things for a month, adding some simple things, probiotics, some natural things to kill yeast, and your month will end with better health. And you've hopefully also established some patterns that you can build on, like avoiding sugar more, eating less dairy, avoiding gluten. And the other nice thing is many people actually have sensitivities to wheat and or dairy. You're also doing an elimination diet of the two most common allergens or things that people are sensitive to. And when you add those back in, if you feel worse suddenly, you've just discovered that's another issue that's been going on all along. And that
without food allergy.
Food allergy.
Right.
Without spending money on any testing, you just did the definitive test, an elimination diet with the re-challenge.
Right, absolutely. And so really it's lots of vegetables, leafy greens. That's one of your favorite. You do like a green smoothie every day.
Yes.
I watch him do it, and it actually is yummy. And then some good fruits and lean proteins, good fats. And what else do we need? Water, good water.
Good clean water. I'd recommend that everybody get used to drinking a good clean water at home. And anything but tap water is a step up.
Right.
And there's in search of the perfect water, I think we're always going to be looking for that perfect water, but anything other than tap water is a great step forward. And we really need to, in our society in America, we drink a lot of juices, we do a lot of coffee, and a lot of soda. Those are horrible for our health, and that explains a lot of our health issues. So if you can encourage not only yourself but your family to be off of those things and just drink water. I'm thirsty, drink water, rather than this kind of craziness we have in the United States where you feel like you need to open a can every time you're thirsty.
Right. So that's just a simple step that you can make today, right? Is just start drinking some good, clean, pure water, not out of the tap. Right. Thank you so much. Do you have any other tips for our audience today, or just sign up? And
one thing I would mention is there's some foods that feed the good bacteria called prebiotics. Prebiotics can be obtained from things like chicory and other things that are a little less commonly used, but you can actually inulin, fructooligosaccharides, are some of the there's several names of the categories. But it turns out that some more common foods like garlic and onions and leeks are actually nice sources. Asparagus has a fair amount of these prebiotics. So eating more veggies and these spices, especially if they're raw, they actually have more of the prebiotics in there, can continue to feed your good bacteria and help maintain your good health.
Awesome. Thank you so much.
Thank you, Sally.
Thank you for joining us. And just sign up at www.yeastfreewithme.com. Thank you.